Hello, I am Pharmacist. Today we discuss about pharmacology, uses, side effects, contraindications, pregnancy warnings, drug interactions, and dose of Piperacillin/Tazobactam. Pharmacology. Piperacillin, Tazobactam is a combination of an extended-spectrum penicillin antibiotic, Piperacillin, and a beta-lactamase inhibitor, Tazobactam. It works by inhibiting bacterial cell wall synthesis, ultimately leading to bacterial cell death. Piperacillin, Tazobactam has a broad spectrum of activity against gram-positive and gram-negative bacteria, including Pseudomonas aeruginosa. Uses. Piperacillin, Tazobactam is used to treat a wide range of bacterial infections, including respiratory tract infections, skin and soft tissue infections, intra-abdominal infections, and sepsis. It is also used for empiric therapy in febrile neutropenia, a condition that occurs when a patient with neutropenia, low white blood cell count, develops a fever due to an infection. Side effects. The most common side effects of Piperacillin, Tazobactam include diarrhea, nausea, vomiting, and rash. Other side effects may include liver toxicity, kidney damage, and anemia. Piperacillin, Tazobactam can also cause allergic reactions, including anaphylaxis, which can be life-threatening. Contraindications. Piperacillin, Tazobactam should not be used in patients with a known hypersensitivity to penicillin or any other beta-lactam antibiotics. It should also not be used in patients with a history of cholestatic jaundice or hepatic dysfunction associated with the use of Piperacillin, Tazobactam. Pregnancy warnings. Piperacillin, Tazobactam is generally considered safe to use during pregnancy. It is classified as a pregnancy Category B drug, which means that animal reproduction studies have failed to demonstrate a risk to the fetus, but there are no adequate and well-controlled studies in pregnant women. However, as with all medications, its use during pregnancy should be carefully considered and monitored by a healthcare professional. Warnings. Piperacillin, Tazobactam should be used with caution in patients with a history of allergic reactions to penicillin or other beta-lactam antibiotics. It may also interact with other medications, so patients should inform their healthcare provider of any other medications they are taking. Piperacillin, Tazobactam can cause a superinfection with non-susceptible organisms or yeast. Drug interactions. Piperacillin, Tazobactam may interact with other medications, such as warfarin, which can increase the risk of bleeding, and oral contraceptives, which can decrease their effectiveness. It can also interact with other antibiotics, such as aminoglycosides, which can increase the risk of renal toxicity. Dose. The recommended dose of Piperacillin, Tazobactam will depend on the type and severity of the infection being treated, as well as the patient's age, weight, and renal function. The usual adult dose for moderate to severe infections is 3.375 grams administered every 6 hours. However, dosages may vary depending on the infection and individual patient factor. Thank you.